Good afternoon, and thank you for joining us. My name is Tina Tebow, and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Today we're reporting 15 new cases of COVID-19. Dr. Strang will have more specifics, but 2 of those cases are school-based. Both schools are closed now until next week for deep cleaning and contact tracing. A number of other schools that were closed as a result of COVID will open on Monday. I'd like to thank all of the people in our schools, from the administration to teachers, parents, and students, for their cooperation during this time. I also want to give a big shout out to the cleaning staff. You have been working tirelessly to keep our schools safe. Your work is always important, but it's critical during these COVID times. I also want to thank all the staff in our labs and cleaning centers, as well as all the volunteers who have been working in our testing sites. In the last 2 weeks, we've conducted over 7,000 rapid tests. We've caught 22 potential cases of COVID from people who had no symptoms. They were told to isolate immediately and then were sent for a second standard test to confirm. Without everyone's hard work to run these clinics, and without all of you coming forward to be tested, we would not be able to track COVID as quickly. Today we are announcing a testing strategy for rotational workers. These are hard-working women and men who leave our province and their families to work for a period of time, usually 2 weeks away and 2 weeks at home. When they come home, they are under restrictions, keep their family bubble close and their movement limited. But now, going forward, they will be tested between day 6 and 8 of their time at home. This will not change any of the restrictions, but it does offer a level of reassurance if they don't have COVID, and if they do, it will help us contain the virus quicker. And nothing changes for essential workers who have been in and out of our province all the time. They are expected to continue to keep their circle tight. So are all of the people living in Central Zone, the greater Halifax area, where we have the majority of our COVID cases. The restrictions have been placed for just over a week now, and we'd intended to keep them in place for 2 weeks, but our daily cases are still in the double digits, and now we'll have to do more to rethink on that timing, and I'll have Dr. Strang elaborate on that.
Thank you, Premier. Good afternoon, everybody. And as the Premier said, we were reporting 50 new cases of COVID-19 today. 10 of those are in Central Zone. 3 are in the Northern Health Zone, and 2 of those are close contacts of recently known cases, and the third one is under investigation. There is 1 in the Western Zone, which is related to travel outside of the Atlantic provinces. The 15 includes the case that reported last night at Citadel High School, and we have a new case today in Parkview School. That one we're just learning more about. I'll just make a couple of comments on the Citadel High School. There were no students in school yesterday because it was a PD day. The school is closed today and Monday, and the target is to reopen that on Tuesday. Online learning is happening for those high school students today and Monday. For those who are in part of that, and if you're part of that school community, you'll get more information on Monday. I want people to be reassured that in any school case, that if you or your child is a close contact, been identified as a close contact within a school setting, public health will reach out and call you directly. And all close contacts of positive cases are tested and then asked to self-isolate for 14 days. In total today, we have 117 active cases of COVID-19 in Nova Scotia. Fortunately, no one is in hospital. And while the majority of our virus activity is still concentrated in the metro area, we are seeing some activity outside Central Zone now too. However, it is reassuring that other than for a couple of exceptions that are still under investigation, the cases we have identified in other zones are either connected to previously known cases or to travel outside Nova Scotia. So far in the second wave, which is since October 1st, there have been 269 total cases. 152 of those are now considered resolved. Today, I'm announcing that the restrictions in place right now in the metro parts of HRM and Hants County will be extended until December 16th. That adds one more week to our original projection. This means that bars and restaurants will remain closed. Fitness facilities, gyms, studios, etc. will also remain closed. Retail operations will remain at the 25% of legal capacity. And only essential travel in and out of the affected areas in Halifax are allowed. So for school, for work, for medical appointments, for necessary legal reasons such as child custody arrangements, travel is allowed. Any other types of travel that are deemed non-essential, we are asking people to not do that. And within the Halifax areas, we'll keep the gathering limits of no more than 5 outside the home. We are still reporting double-digit cases, and we have every day this week. Modeling projects that this will continue for several more days. Public Health still has 1,178 open investigations, and the number of close contacts for each case remains high. So we need more time with the existing restrictions in place to see these numbers come down and be certain that they will stay down. I know this is especially hard as we enter the holiday season, but that's precisely why we're doing what we're doing now. I can't make any promises about where we'll be in 3 weeks, but what I can tell you is that the more we buckle down and stay tight right now and for the next couple of weeks, the better position we'll be to be able to have some slight relaxation as we enter the holiday weeks before January starts. But all we have to do is look around us in other provinces and understand that what we're doing in Nova Scotia is absolutely the right thing. React quickly, react firmly, and make sure you keep the restrictions on until you're very comfortable that you can start to release them without sparking a rapid resurgence. We understand that the pandemic has been particularly hard on rotational workers and their families. Since March, they have been spending most or all of their time in Nova Scotia in a modified quarantine that allows contact only with household members. That is tough on everyone involved, and I really feel for the people in this situation. They're doing what they need to do to support their families and contribute to the economy of Nova Scotia. But unfortunately, the modified quarantine period is necessary. Given the case numbers we're seeing in other provinces, outbreaks in many of the work camps that the rotational workers move in and out of, and the frequency of their travel, we just cannot lift their modified quarantine at this time. It's important to understand, I'm not blaming rotational workers in any way. They are doing their jobs and supporting their families, like I said. And it's disheartening to hear when I hear stories about how unfairly rotational workers are being treated in some of their communities, that they and their families are being ostracized and stigmatized. Stories about their kids not being allowed to go to hockey and being treated in unfair ways. That is just not right. Rotational workers are making enormous personal sacrifices to keep our communities safe and healthy in the midst of this pandemic. So please be understanding and supportive of your neighbors who leave the region for work. Life is already challenging for them and their families, and please do not make it harder. Rotational workers do have a modified isolation that gives them a bit more freedom when they're home. As long as they don't have symptoms, they do not need to isolate from other members of their household. And they're able to leave their property, such as, for instance, to go for a walk or a bike ride, as long as they distance even outdoors with people who are not from their household. They can also do things like drop their children off at school or activities, do contactless grocery or other shopping pickup, and go through a drive-through. Up till now, this modified form of self-isolation was only extended to rotational workers who work in Canada. But we have finally had clarity from the federal government, and now these requirements can also apply to international rotational workers as well. I know many rotational workers have been hoping for a testing approach that would eliminate the need for them to isolate completely as long as their test was negative. And we've been hearing a lot of people about how we need to follow Newfoundland's approach. But now even Newfoundland has changed how they approach rotational workers during the second wave of COVID. Testing in that province does not allow rotational workers to stop isolating. So in Newfoundland, if they're tested on day 7 or later and the result is negative, they can start a modified form of self-isolation similar to what we have. So for now, there is no change to the self-isolation requirements for rotational workers. We are, however, going to add asymptomatic testing for them. So starting today, rotational workers can book a test on day 6, 7, or 8 of their isolation period. It's important that they understand that a negative result reflects only one point in time, the day the test was done. A test done 2 days later could be positive. So that's why we're continuing self-isolation. It's so important, the limitations of one-time testing. But the timing is late enough that we'll have a better chance of detecting the virus if a rotational worker does become positive once they return here. And it's still early enough to isolate household contacts before they're able to spread the virus to anyone else. So again, a negative test result on day 6, 7, or 8 is not definitive, but it's a good indication that someone is less likely to be carrying and spreading the virus unknowingly, and that members of their family won't be doing so either. It's an added layer of protection for rotational workers, their families, and their communities. There's no cost to the testing to rotational workers, and it is voluntary, but I strongly recommend that they use this testing to help protect themselves, their families, and their communities. All they need to do is complete the online self-assessment by going to the 811 website, and the Nova Scotia Health Authority will then call to book an appointment. The testing will be done at primary assessment centers closest to the where the individual lives, and it has to be done through appointment. Do not go through pop-up sites. Sorry, I made a mistake. When I talked about a school, I used the name Park View. Sorry, that is a school in Bridgewater. The name of the school that is a case tested today is Park West, which is in Clayton Park. My apologies for that. So it's Park West, not Park View. Thank you, Tina. As we've seen, asymptomatic testing can play an important role in protecting our communities during the second wave. We've already seen that with our testing of bar staff and patrons. That initiative, which has just ended, resulted in a total of almost 12,000 people being tested, and the vast majority of them had negative results. It's showing that this type of asymptomatic testing is an important addition to our surveillance, COVID surveillance toolbox. And when we do get positive tests, we're able to manage these cases and help prevent further spread by the early identification. And very often, the positives have been people who are asymptomatic and would have no idea themselves that they're positive. So next week, we're expanding asymptomatic testing across the province. We especially want to see people who are 16 to 35 years old, who do not have symptoms. Anybody who has symptoms needs to go through the online self-assessment process. But if you're asymptomatic, especially if you're 16 to 35 years old, if you've been to an indoor social gathering in the last 2 weeks, especially if it was over the gathering limit, or you have a lot of close social contacts, many different people in different groups. Those are the ones who are at the greatest risk. They may have been exposed to COVID, and those are the groups that primarily we want to come forward for asymptomatic testing. But nobody will be turned away if they show up for that testing. I want to be clear that this is not about people getting in trouble, and no one is going to be fined as part of this initiative. You're not going to be asked why you're coming for testing, but I put those reasons forward now because we want to focus our efforts on those who are most likely to have asymptomatic infection. It's critical that as part of our efforts to rapidly control the second wave of COVID in this province, that we find asymptomatic people and identify them, isolate them, identify their contacts. If you're in Central Zone, you can continue to go to the primary assessment center at the Dartmouth Sportsplex. For that primary assessment center, you do not need an appointment. You can just walk in. If you're in northern, eastern, or western zone, you will be able to start early next week to use the online self-assessment tool to book your test in advance. And there'll be more detailed information to share on this early next week. I'd like to move on and provide a brief update on vaccine planning. That's certainly a topic that's been a lot of media coverage in the last few days and a lot of activity. We continue to work closely with our colleagues in Ottawa to make sure we are ready to accept the first doses of vaccine as soon as it becomes available. And this includes the capacity of having ultra-low temperature freezers for storage. The Pfizer vaccine, which is the product that requires that type of freezer, will be the first one available in Canada. And yesterday, the federal government said we can expect approval through Health Canada as early as next week. That is a critical step in this process. We cannot use a vaccine before it gets federal approval. Another development is that the updated guidance was released today by the National Advisory Committee on Immunization, or NACI. In November, NACI released high-level guidance on priority groups for COVID-19 vaccine. And this week, they narrowed the scope of that guidance even more and identified the following priority groups, knowing that we're going to have a limited amount of vaccine at the beginning and we have to prioritize for those who are at greatest risk. So the priority groups are long-term care residents and staff, frontline healthcare workers who are at highest risk through providing direct care to COVID patients, and older adults, those who are at the highest risk of severe illness and even death from COVID. So starting with those who are 80 plus, then moving to 75 and up, and then 70 to 75. It's up to each province to determine within that guidance from NACI about exactly how the vaccine will be rolled out. And my team and I, along with lots of people across the government, are working on this planning diligently right now in Nova Scotia. We are expecting the first allotment of vaccines to start early in January, along with a very small an initial amount in the middle of December. And once we start to get regular vaccine in January, it's expected to be small weekly amounts for the first 12 weeks of the year. So we are going to have to work very closely across the health system to match up the amount of vaccine and the requirements for storage and handling and where the vaccine can be administered along with our priority groups. So there's a lot of detailed work between now and January that will be needed to be done, and that has begun. The federal government has said that they expect to be able to vaccinate every Canadian who wants to be vaccinated in 2021. And that's certainly our planning in Nova Scotia is built along that expectation. So things are moving very quickly on the vaccine rollout, lots more to come, and I will continue to keep everyone updated regularly through these briefings or other mechanisms that we communicate to the public. So before I close out today, I just want to encourage people who are going for testing to opt into the email result option if they're going to a primary assessment center. That doesn't apply to the rapid testing, but if you go to an assessment center, you're going to be asked how you want to receive your result. It is the fastest way to get your result is by giving your email. We're still seeing lots of people who aren't understanding that. It certainly makes our work more efficient if we can give you an email result rather than having to make a phone call. So we encourage everybody to opt in to get their test result by email. If you're a negative result, you'll get that. If it's a positive result, you will be contacted directly by public health. I also want to remind everybody that travel in and out of the Halifax area for medical care is considered part of essential travel, and so coming in and out for doctor's appointments, blood work, x-rays, and other imaging is essential, and it is allowed. So please keep your appointments. The NSHA and the IWK have measures in place specifically for patient and staff safety, such as visitor restrictions, screening at entrances, requirements for masking and distancing. So those facilities are safe, and you should not delay your scheduled appointment or care. I'd like to end the week on a positive note. I know we've talked a lot lately about people ignoring the rules when it comes to masks, gathering limits, non-essential travel. And I know these stories are frustrating to hear, but for every story about someone not following the rules, there are dozens of untold stories about the many Nova Scotians who are following the rules and following them for the right reasons, who do the right thing day in, day out to protect each other. These are the stories Nova Scotians are known for. And I've always been really proud as a Nova Scotian of that fact. And that community mindedness has been recognized nationally too. But I'm not sure that I've been ever prouder than I am now. Even after 10 long months, the majority of people continue to answer the call to do what is necessary, despite the challenges and the impacts, to keep your family, your neighbors, and your community safe. So for all these good news stories that don't get told, thank you. Premier.
Thank you, Dr. Strang. Tina?
Again, just a reminder, we'll take one question and one follow-up from reporters on the phone in the allotted time that we have for today's briefing. We'll start with Elizabeth McSheffrey from Global. Go ahead, Elizabeth.
Hi, Dr. Strang. I would just like to start by asking for some clarification on the indoor gathering limits. I'm looking at the website, and it says the gathering limit within a household without social distancing is no more than 5 visitors at a time. No matter how many people live in the house, max 5 visitors. So it seems to imply that, a family of 5 could have 5 visitors, but no more. But then it right after says indoor and outdoor gathering limit is no more than 5 people with social distancing. I'm just wondering if you can clarify which is it. Is it a maximum of 5 with social distancing, or is it 5 plus the household members?
So there's
without
two.
social distancing?
Yeah, there's 2. Within a household, we did not want to penalize larger size families and put just a restriction of 5, because that meant that a family of 5 couldn't have any visitors. So if it's your household, it can be whoever is in your household plus up to 5 additional visitors at any time. So that's within the household. Anything outside of the household, and this is in the affected Halifax areas, anything outside of the household is no more than 5 people.
Carla?
And that is for social gatherings. It doesn't mean that if there's a family of 7 people that they can't go out for a walk together as a family. But when they get together socially, anything that's about a social gathering outside of the home is a maximum of 5 people.
Just a reminder. Hang on, Elizabeth. We can hear someone else talking, so if you're not asking a question, please have yourself on mute. Go ahead, Elizabeth, with your follow-up, please.
And just following up on the rotational workers, testing on day 6, 7, 8, I wonder why that's something that's being brought in now and why it couldn't have been done earlier.
So we've made substantive investments since September on building capacity and testing. We started first with our university students, and we've been working in a number of other ways. We were able to finally bring on the rotational workers within the capacity that we've been building.
Next, we'll go to Mike Gorman from CBC. Go ahead, Mike.
Thank you. Dr. Strang, with the plan to roll out rapid tests next week province-wide, I wonder if you could speak for a minute about what our supply is looking like at the moment, given how extensive it's been in HRM so far, and whether or not you think we will have access to enough supply to continue to do this as long as you feel it's necessary.
So I'm assuming you're talking about lab supplies. So it's important to understand that the asymptomatic testing we're doing has 2 components. What we announced today was testing through the existing Nova Scotia Health Authority primary assessment centers. That is a swab that goes to the lab for a PCR test. And we're rolling that out in a way that we know that is within the capacity that we have built and we can sustain for a limited period of time, both staffing-wise as well as the number of tests in the lab. We are also looking at how we potentially can continue the pop-up sites that that use the rapid tests. They have been a big success. We just have to do some further work to ensure that that's a sustainable model moving forward. And we'll be able to talk more about that next week. But we still also, even the rapid testing, there is a substantive supply of rapid test kits that continues to come through the federal government. So I'm not concerned at all about our supplies. For the short period of time we're talking about, we've worked closely with the health authority this week to make sure whatever we're rolling out, that they have capacity within the PACs, as all the other pieces in terms of taking calls, et cetera, that we can accommodate people's needs.
Great, thank you. And I just wonder, Dr. Strang, if we go back to the school issue for a moment, I'm sure it comes as no surprise to you that as we see more cases in schools, people's concern levels start to go up. And so could you speak a bit in general about your thought process as you look at what's going on in schools, about what you're looking for and what you're thinking about as you determine how public health and, by extension, the education system needs to respond in terms of whether or not kids stay in school or a school closes or perhaps switches to a hybrid learning model?
So we continue. We've worked since June closely with education. It's important to understand that yes, we've had I think about 8 cases now, individual cases in schools. In a couple of cases, there's been 2 cases in a school. But we haven't seen, we've done a lot of testing around all of those cases, and we'll continue to do testing of close contacts. Other than one identified close contact, we've tested dozens and dozens of people who were close contacts in a school. They've all been negative. All the cases that have happened in school, the exposure wasn't in the school. It's people who were exposed somewhere else and then had been in the school while they were infectious. So I'm very comfortable that our schools remain safe places. We're not seeing schools as a place that is causing significant transmission of COVID-19. We have appropriate steps in place to maintain that safety. And we will respond on a case-by-case basis, as we've been doing around individual cases, making a determination of a combination of public health and operational factors that go into say how long we're going to close a school down. And we're always going to err on the side of caution. And we continue to work together to look at the epidemiology that where we might have to move to the blended learning model. We have not been, and nothing I see at this point in time that would suggest that we would need to move to that blended learning model anytime in the near future.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Hi, Dr. Strang. Following up on that, on my colleague's question there, it looks like you're erring on the side of caution in terms of the overall approach to Halifax. I'm wondering why you wouldn't do that with schools, given that, yes, there haven't been a large number, but they have crept up lately, and they've been spread out. So I know that the education minister said earlier this week that there were actual talks about looking at extending the upcoming Christmas break. Where are those, and is that something you're seriously considering now, given what we've seen?
I mean, the discussion around extending the Christmas break, that has been discussed at the Department of Education. At this point in time, where we're at with our epidemiology, that would be much more from the perspective of an operational reason within the education system. We'll certainly contribute to those conversations and say, what is the epidemiology telling us? But epidemiology is one of a number of other factors that the school system needs to consider.
Go ahead, Keith, with your follow-up.
All right, and as per your decision extending the rules in Halifax, can you give us a little more information as to why you made that? And it seems to be coincidental that last night PEI decided that instead of waiting for its deadline on the bubble, given the situation in other provinces, that it's actually going to extend its decision on whether to rejoin for another 2 weeks as well. It seems like everybody's being just extra careful at this point.
So it is. I had no idea the PI had done that, and we are being extra careful. We will always err on the side of caution. So when we looked at it, it really was, even we've said all along, 2 weeks, but we might well have to extend for another week. Where we're at, it's quite. I was in a situation where it was quite likely that next week, we'd be advising the Premier that we need to extend. So our discussion was really about, let's err on the side of caution. Let's give people more clarity and certainty and just extend it now. And then so people know what the next couple of weeks really looks like. And then we will be able to have a more intensive discussion with the epidemiology that we see over the next week. The results of the asymptomatic testing are going to be very critical. If we do a lot of asymptomatic testing outside of HRM and we have zero positives, that's very reassuring. If we pick up positives, that's telling us something very different. So we need time to put all that together and have a thoughtful discussion, knowing also that as we're heading into the holiday season, that we need to be very careful and cautious even as we start to lift restrictions, because the holiday season is the time of social gatherings and people getting together. And what we want to avoid is starting to lift things too early and then coming back, and then early in January we have a significant resurgence of COVID again. So we're always going to err on the side of caution, and we're doing that and giving people more certainty and clarity by just announcing it today rather than next week.
Next, we'll go to Jonathan McGinnis from CTV. Go ahead, Jonathan.
Hi, good afternoon. You spoke about the priority vaccine groups. I'm just wondering, once complete, how will the vaccines be administered to the remainder of the population?
So that's to be determined still. It depends on our first objective now. We're focused on really planning for the first few weeks when we have limited supply and priority groups. And we are starting to turn our mind to what then a more of a mass immunization clinic looks like. We have a number of options. It's premature to kind of speculate on that. There's going to be a lot of planning work that happens in the first few months of 2021 as we start to plan for broader mass immunization.
Jonathan, go ahead with your follow-up.
Yeah, I believe you addressed this. I may have missed it. Do we have the ability to store the vaccine once it's being distributed?
Yes, we've identified an ultra-low temperature freezer for the very initial amount that we could get in the next week or so. We're in the process of the federal government is providing another ultra-low freezer for our biodepot, and we're in the process of looking at what our additional needs will be and filling those needs provincially as well. So we will have the plans in place, whether it's ultra-low freezers, more of the regular freezers for other products, and even fridges and other kind of smaller units that are needed to transport the vaccine, whatever the product, from the storage place to vaccine clinics.
Next, we'll go to François Pierre Dufault, Radio-Canada. Go ahead.
Hello, Dr. Strang. A question for you. We've seen over the last few days more cases that are confirmed in the northern part of the province and more possible exposure to the virus as well in that region. I just want to hear you. Are you concerned about the spread of the virus beyond the Metro Halifax region?
No, the cases we have in Northern Zone are all very explainable. Most of them are linked with people who have, first and foremost, who work and travel into HRM, and that was their source of exposure. Some of our more recent cases are now contacts of existing cases within a household setting, or direct contact with a known case in another way. So that gives us much more reassurance that what we're not seeing spread within the Northern Zone at a community level. But we continue to assess any case that happens outside of HRM. I know public health is looking at with an extra set of cautious eyes, looking for any sign that we may have community transmission outside of the Halifax area. At this point, we do not have any sign of that.
Go ahead, Francois, with your follow-up.
This question would be for Premier McNeil on a different topic, if I may. The RCMP announced a few hours ago that they've laid charges against 3 individuals in relation to the Port-de-Pic tragedy. I just want to hear your thoughts on that.
Well, I heard about those the same time you did. I read them. Any questions related to that should go to the RCMP.
Next, we'll go to Stuart Peddle from the Chronicle Herald. Go ahead, Stuart.
Hello. My first question is related to schools again. Do you know how widespread
the contacts are, what kind of a time frame you're talking about for tracking those contacts of the positives, particularly with the most recent ones like Citadel and the Park, the one in Clayton Park, because there needs to be what kind of turnaround are we looking at for the testing for them, and then that would lead to how widespread then of an issue that would be for parents.
One of our priorities when we get a positive case, one of the first pieces of information we get when we start to interview that case is, have they been in a high-risk environment, whether it's a long-term care facility, a school, etc. As soon as we are aware of it's a school, the team then connects directly with that school and the Regional Center for Education, and we make it a priority to figure out where the person has been within the school, who may be a close contact, and we have a definition around that, classrooms, etc. So we work rapidly, and in every school case we've had, within 24 hours, we have a clear understanding of who the close contacts are in the school. They are all put on isolation. Arrangement for testing has been done, and then we close the school for an appropriate period of time to allow both work to be done in the school, but allow some further assessment if we need it on cases and contacts, and to allow some of the testing of contact, their test results to come back, so we can understand if there's been any additional contacts who are testing positive. So we work rapidly, and I'm very proud of the work that public health does in collaboration with our education partners on placing a priority on protecting the safety of students and teachers by that rapid investigation.
Go ahead, Stuart, with your follow-up.
Second one is generally have data around active cases in the capital area, the central zone. Do you have a percentage of how many are community spread and how many are traceable for the data as to close contacts, as to travel? We're wondering about what the spread through community spread that you can't clearly define. Do we know the proportions of each?
Yeah, we do keep track of that. I don't have the exact numbers in front of me, but last looking at that yesterday, I think it was around 40% of our cases, and that was provincially. We have to attribute to community spread.
Next, we'll go to Lindsay Armstrong from all Nova Scotia. Go ahead, Lindsay.
Thank you. For Dr. Strang, the Pharmacy Association of Nova Scotia has said they are eager to support the province's efforts for vaccine administration, and they have not yet been contacted by the government. Recognizing that the province has entrusted pharmacists to widely administer the flu vaccine, will they be involved in the rollout of vaccines and administering them here in Nova Scotia?
So as I said earlier, our focus is right now on the first few weeks getting the initial allotments of vaccine out because of the groups that we've identified: long-term care staff and residents, specific healthcare workers in hospitals. The vaccination will be done by a combination of occupational health, public health, and other frontline nursing staff in facilities. Certainly, as I said, I answered to an earlier question, as we then after the new year, look at how we then start to plan more intensively for mass immunization, which is likely to be coming in the second quarter of 2021. We'll be engaging our Doctors Nova Scotia and the Pharmacy Association intensively in discussions about potential roles that they may play as we need to look at a much broader immunization campaign, as I said, starting in the second quarter of 2021.
Go ahead, Lindsay, with your follow-up.
Thank you. I'm wondering if you could tell us more about that first ultra-low temperature freezer that the province has acquired. Where was it from? What sort of capacity does it have? And what sort of capacity are you looking at for the next freezers to be able to keep your doses ready to go for that December 14th date the federal government has given?
So the initial freezer we've identified as part of the tertiary care and teaching hospital complex here in Halifax. It's already on site. It's been validated and cleared, and that's all set to go to receive vaccine whenever it's available from the federal government, that very initial allotment. We are also working intensively. The federal government has committed to providing at least one ultra-low temperature freezer to every province and territory. The one that we're going to be getting from the federal government will will be at our central bio depot for vaccines at the public health offices in Burnside. And then we'll look further from that. We're looking at other sites that we may need to have those type of freezers.
And we have others that have been identified within the private sector as well. And through our own procurement are looking at purchasing what required. But I want to thank everyone who's been working very hard to ensure not only do we have the supply to deliver, quite frankly, the vaccine when it arrives, but the equipment to be able to store it. We are in great position to be able to receive not only the Pfizer vaccine, but vaccines as it comes available and comes online.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, Dr. Strang. Last week or so, you told us about a change in policy in terms of the public advisories that in the relatively low-risk retail sites, there would no longer be the monitor for symptoms because people should be monitoring for symptoms regardless. However, yesterday, 2 advisories were sent out that were exactly for monitoring for symptoms in retail sites, the Truro Walmart and the Milford Foodland. Why the change?
There was no change when I announced that that was specific to the Halifax area. Because of the increased activity in Halifax, we wanted everybody to have a heightened awareness of monitoring their symptoms. And so we were moving away from the low-risk general announcements on exposure sites in the Halifax area. In other parts of the province, because we don't have the same level of activity of COVID-19, we are still sticking with the low-risk announcements because we're at a different place. And just like we start, several weeks ago, we were doing the low-risk announcements in HRM, and then moved away from that. We're doing the low-risk announcements in other parts of the province. And if we get increased activity, which I certainly hope we don't, we will make the same change that we did in HRM.
Go ahead, Tim, with your follow-up.
Makes total sense. A lot of people on my Twitter feed, I guess, could not help but recognize the timing of the announcements that came out yesterday. 2 flights coming in on one day, and then the next day there's 2 retail sites named. Was there a case of people not self-isolating?
No, none of those announcements are not related to people not self-isolating. The announcements around the flights are simply a reflection. We've had it's been several weeks, but we've had a couple of our most recent cases are people who have had travel outside of the bubble, have isolated as they're required, but they then become symptomatic and then went for testing, but they've maintained their isolation. But they traveled by air before they became sick, but it was still as judged to be within their infectious period while they were traveling, remembering we always go to the 48 hours before somebody became sick and include that in their infectious period, and therefore we did a public announcement on their flights.
Next, we'll go to Ed Halverson from QCCR Radio in Liverpool. Go ahead, Ed.
Dr. Strang, we've heard a lot about the school closures, and when they are closed, they go through a deep clean process. Can you elaborate on what those deep cleaning standards are?
It's just really making sure that the current standards we have for cleaning are that there's an extra cleaning that's done in the school, and making sure the entire school is given that clean to the regular standard as it should be. But we're just making that this is just part of another reassurance that before we reopen the school, that is not the greatest risk of how the virus is transmitted, but we're always erring on the side of caution, and we're just making sure that there's an appropriate cleaning done of the school to the standard of cleaning that's always applied in the school. I do not at all want to give an impression that we have a lower standard of routine cleaning than we use when we're using in response to a case and before we reopen the school. It's just using that same standard once again to make sure that things have been done properly before the school is reopened.
As I did in the opening, I want to give a shout out to all the custodial staff across our province who have continued to work in our schools, continue to make sure that the environment is safe and clean for students and staff. Since September, there has been an enhanced number of cleanings and people in the buildings to keep them clean. Whenever, though, we see a case of COVID, we provide them with the ability to be able to go and clean that school free of people being in it. I think that's an important distinction, that they have the ability then to have free reign of that school for a period of time to allow them to make sure that that cleaning is completed before anybody comes back in.
Go ahead, Ed, with your follow-up.
I have no follow-up. Thank you.
Great. Next, we'll go to Kyle Shaw from the Coast. Go ahead, Kyle.
Thanks. I'm wondering, do you know if the COVID Alert phone app played any part in alerting people to get tested yet, or led to any positive COVID tests in Nova Scotia? And should people still be downloading it?
Absolutely, people should still be downloading it. It's still a valuable tool. We don't necessarily track that, so I'm not aware. I don't have any information one way or another where of any of our cases the COVID app has been part of that.
Go ahead, Kyle, with your follow-up.
And then I'm still, after today, I'm still kind of confused about what numbers matter. The other day, Dr. Strang suggested that the daily case numbers we're getting are a pleasant surprise, given they've stayed well below that peak of 37 cases. But then obviously today, the fact they're still in double digits is worrying enough to extend the restrictions on Halifax. But then also Dr. Strang said the number of close contacts per case is still too high. So can you say what exactly is the number of daily cases you're looking for to reopen Halifax? Or if this number of contacts per case is the key number, can you start publicly reporting that number?
So as I've said before, there's no one number, and we don't focus our things just on a number. We look at the number of daily cases. We look at things like the number of what is the doubling time? What is the time it takes to double our number of cases? We look at the number of average number of contacts per case, but we also look at the context around each case. How many of them were asymptomatic that we didn't know of before? How many of them are related to community transmission versus contact with previously known cases. So there's a number of things that we put together to give us the overall epidemiologic picture, and that requires to put that together. We have I'm very proud to acknowledge my epidemiologic colleagues who put that information together. But then it's not just putting that information out. You have to have people with training, like my MOH team that does that along with the epidemiologist to make sense of all that information and to put together an overall conclusion. That is fundamental work that public health is trained in, putting all those different pieces together. So it's not as simple as one number or another number and just putting that out publicly. It's a much more complicated assessment based on experience and training.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
Good afternoon, Dr. Strang. If I understood you correctly in your response to Lindsay's questions, you would expect that those at the front of the line will be vaccinated through January, February, March, and April, and correct me if I'm wrong. I just wondered how many people do you expect to get vaccinated who are at the front of the line, and then what happens, or how many more are kind of in the queue after that?
So right now, Jean, we're working. We don't know how much vaccine we're going to get. We've got estimates of probably enough vaccine in the first 12 weeks to do, or sort of the initial allotments to do about 75,000 people. But there's no guarantee on those amounts. We heard some troubling news yesterday that Pfizer is decreasing their production for some reasons. We're also working with our risk groups to put together what are the number of people in each of those risk groups. So that's the work that'll start to happen as we match up. Once we get certainty of how much vaccine, we know how many people in each risk group. We then have to match that up. Is the challenges, especially with the Pfizer vaccine, the requirements about where you can actually do the immunization because of the temperature requirements. So there's a complicated calculus about vaccine amount, risk groups, and facilities where you can immunize folks. And that's the logistic planning, which is going to be starting next week. We're getting a team of logisticians coming from our Canadian Armed Forces colleagues to support us. And that's exactly the work we're going to be doing to do that complicated logistic planning. So I can't tell you exactly how many people are going to be immunized by a certain date at this point in time.
Go ahead with your follow-up, Jean.
And Premier, as you know, you and your colleagues have been talking at length recently about how much doses or how the doses will be parceled out. There's been a lot of discussion about per capita share. Obviously, your colleagues in provinces harder hit would like to get their more than their share per capita. And of course, in discussions about healthcare funding, you have talked a lot about our aging population and the fact that we should get more money from Ottawa given on that. What is your government's position vis-a-vis vaccines, and how many should be coming Nova Scotia's way?
So first of all, there's been a tremendous level of cooperation amongst all of our provinces and the federal government when it comes to the issue of the pandemic, and the vaccine is no different. We believe that'll be distributed on a per capita basis as we go forward. We as a province have worked very hard to ensure that we have the appropriate infrastructure. There's been questions about freezers today, but also syringes. We make sure we have the appropriate swabs, all of the things that are required to deliver the vaccine when it arrives. And quite frankly, I think the national government has continued to work very hard with all of the suppliers around the world to ensure that Canada is near the front of that line when it comes to delivering that vaccine. So as it comes in, as we start seeing it come into Canada, we expect that to be delivered on a per capita basis. And our job as the national government is to secure the vaccine. Our job will to make sure that the infrastructure is in place to deliver to Nova Scotians when it arrives.
We have for questions today. Go ahead, Premier.
Thank you, Tina. Dr. Strang and I know the restrictions that we've put in place have been difficult on businesses and families. We especially know it's been hard on families who have lost loved ones. You cannot have that celebration of life, and as we all know, that's an important part of the mourning and healing process. And for that, we are deeply sorry, but our goal is to try to keep you safe. That's why we're constantly looking at how we move about this province, because there's one thing we know for sure: COVID moves fast, and the restrictions and the protocols and the testing is our best chance to stay ahead of COVID. We're also now heading into the Christmas season. It's usually a time to shop, a time to gather with friends and families, but right now all of that is limited. Over the next 2 weeks, Dr. Strang and his team will be reviewing the epidemiology, and he and I will have a good long discussion about Christmas and what it will look like. One thing we know for sure: Christmas will look very different this year. And I want to take this final moment to recognize the National Day of Remembrance and Action on Violence Against Women, which is this Sunday, December 6th. You'll notice Dr. Strang and I are wearing purple ribbons. This is a time to honor the memory of all women and girls whose bright futures were lost to gender-based violence. Today, I, along with 3 Atlantic premiers, announced the Atlantic Domestic Homicide Review Network to help prevent domestic homicides. It's the first regional network of its kind in Canada. Understanding domestic violence trends and circumstances, we hope, will help us identify gaps in our system so that we can work with our partners inside and outside of government to prevent gender-based homicide into the future. This weekend, I want all of you to take some time to express love and support to your mothers, to your wives, to your sisters, and to your daughters, all the women in your life. Be grateful for them. Show your gratitude, but most of all, show your respect. Have a safe weekend.